Lurasidone. It is also a neuroatypical antipsychotic with 5-HT2A and D2 antagonistic properties. Has high affinity for both 5-HT7 and 2A receptors, moderate affinity for 5-HT1A and alpha-2 receptors, yet minimal affinity for H1 and M1 receptors. Generally is without sedation and along with ziprasidone and aripiprazole has little or no weight gain or dyslipidemia and virtually no QTC prolongation. If switched to lurasidone from previous agent associated with weight gain and dyslipidemia, such side effects may even reverse. A starting dose of 40 mg is an effective antipsychotic dose, although studies suggest that for maximum long-term efficacy, doses up to 160 mg per day may be useful in some patients. Might cause moderate EPS, but this can be reduced if given at night. As with ziprasidone, absorption of lurasidone is much greater when it is given with 500 calories of food. Its robust antidepressant efficacy is explained by the receptor binding profile of 5-HT7, 1A and alpha-2, and thus is effective in bipolar depression as well as mixed depression. As previously studied, 5-HT7 receptors are located both on GABA neurons in the raphe as well as in prefrontal cortex. And stimulation of these receptors by serotonin is thought to release GABA and thus serve as a negative feedback loop and turns off further serotonin release. On the other hand, blocking these 5-HT7 receptors causes decreased excitation, that is, inhibition of the GABA interneurons, and thus leads to increased release of serotonin from these raphe neurons wherever they project, theoretically causing an antidepressant action.